helping to train nurses is so important. And I know at our institution, we have a major initiative related to goal-concordant care. And so we have used the Ariadne Lab for serious illness conversations. It's out of Boston, and it's a training program for providers. So APPs as well as physicians go through that training. I'm one of the trainers in that program, is how we can have an build trust and have that empathetic relationship with our patients, and say things like, we were hoping that we weren't going to, be in this situation, but I'm afraid. In other words, those empathetic statements that we give to our patients and let them know that we're in this, together. Um, so that training program again, for providers, we also have a training program. LNAC is certainly helpful in kind of educating nurses how to have that end of life nursing education consortium. The LNAC training program, I think, is excellent for doing that. We also have another education program for nurses for communication, and when we have those difficult conversations. So how can we train that? And I've been involved with that program. So I think there's several programs out there, and really encourage institutions to look at some of those programs that are available. But, just when I talk to new nurses residency program and the APRN fellows that I just talked with, I also do a lecture on ethics in the LNAC program, as well as we do quarterly ethics discussions for our nurses. We have 4,500 nurses that work at MD Anderson, and so we try to do those trainings and then encourage them, if they have a real interest in ethics, is to take that certificate course or some other educational program that they can take that would help prepare them, to have those conversations that are so important. And nursing is certainly an important part of it. As you know, many times, the medical team will come in and have those conversations with patients, and then it's the nurse who's there afterwards and answering questions that they may have related to some uh, phrases that the team used or explanation of what was said. I think it's finding your champions. I mean, we've worked closely with our nursing department and nursing division here at Anderson, and got full support from the nursing leaders here at Anderson. And so that was definitely a plus. But finding your champion and joining your ethics committee, finding out if there's a ethics committee that nurses could be involved in, and joining that. And then from there, work with the members of that ethics committee to see about starting something similar, like our ethics in nursing practice program. Um, Going to meetings such as the meeting I was at earlier this month, Ethics of Care meeting, which is in Los Angeles every year. It's the National Nursing Ethics Conference. And it's a wonderful 2-day conference in LA every year in March. It's usually in March. And, just learning more about it. We also need every time I talk with our nursing director here, she would ask, isn't there a certification for nurses in ethics? And I have to say no, but I happen to be on the bioethics expert panel in the American Academy of Nursing. And I've been challenged to see if at some way we could have that special education and special certification for nurses in ethics, because I think it's an area, with our political discourse and our climate and everything. I think, we need to look at making sure, especially our most vulnerable patients, are supported, and that we have resources for them that will enable them to flourish and enable them to live a life that they want to live. And so I think when nurses get involved with the ethics and ethical issues, I think it really helps along those lines. Having a 50-year career in nursing, I can, you know, seen some amazing changes that has happened in our oncology care as well as then in the ethics. When I started my career, we had a very paternalistic uh, situation in, with ethical decisions. It was basically, I also had a physician father who, felt like, the patient needed to do whatever I said and I would make decisions and all the rest. It was a very paternalistic system. And seeing it change then over the years to really patients being more autonomous, making, you know, encouraging patients to be part of that goal concordant care, having patients, develop that shared decision-making model with our physicians and our medical teams and nursing teams, I think has been, wonderful for patients. I think the difficulty sometimes lies as we go through that. The difficulty lies in when the patients, are demanding care that unfortunately, I sometimes will say to the patient, our science has not moved far enough, fast enough to be able to offer you a cure or offer you, a long remission for controlling your disease. But and trying to help them understand that we're coming at the limit of in terms of what we can offer to control or to cure their diseases. And I think that's a major challenge, is helping patients understand that. I think the other challenge too has to do with, we're given so many tasks. And when we've done this study looking at moral distress, one of the things nurses recognize is the extensive documentation and the time that they spent away from the patient in the documentation of things. And so, which is another challenge, I think, is how do we maybe minimize challenge or reduce it, the documentation or the other things that the nurses have to do, which is not directly related to patient care and quality of care. And so, which is another challenge I think nurses have, to make sure that that patient understands that we're there for them and we want to help them through the challenges that they face, especially with cancer care. And so I think, that's an important step. Our technology is really advanced so far. Unfortunately, as I said, not far enough for some of our patients, but, we have to use our resources wisely too. We have to, be good stewards of our resources too. And so helping patients, no matter what the transition is. Some of the most meaningful interactions I've had with patients have been, that point of helping them work through that last transition at the end of life. And so many patients I remember, turning to me as the physician might have told them that they were at the end of life and at the end of treatment, and then the patient turning to me and asking if I was going to help them through that next phase and transition too. And I think it's really important for us to be there and to have that relationship with our patients.